afternoon. So I'm going to talk about a piece of work I've been doing as part of my Masters with the University of Sydney. And this has a very deep personal connection for me. It's something that I started doing following the suicide of a friend of mine who had undergone treatment for curative breast cancer. So part of the aim of this research is therefore to ensure that more people in families affected by cancer, including healthcare professionals, get to spend more quality time with their families. So that's me and my little family there. And we started this project with a systematic review to find out what we do know and what we don't know. What we do know is there is a need for radiation therapists as well as other healthcare professionals to know more about anxiety. We have patients who are presenting with anxiety. We have patients who are reporting in a radiation therapy department that they have unmet psychosocial needs. We have radiation therapists that are currently developing relationships with patients that are valued by the radiation therapists and the patients, and that are helping to decrease patient anxiety. And we also know that screening is feasible in a radiation therapy setting or a radiation oncology setting more broadly. And in some of the research, it's been shown that it's actually more valued by the patients than by the RT specifically. What we don't know a lot about radiation therapists. We don't know what radiation therapists, what kind of training they have with respect to psychosocial care with anxiety and depression. We don't know what their skills are in detecting specifically anxiety or how they manage that. We also don't know how much awareness radiations have or how much engagement they have in the processes that are already around and in practice within the departments in which they're actually working in. So we set out to develop a survey, and with my supervisory team, we have expertise in radiation oncology, radiation therapy, psychology, and communication skills. So the survey itself is broken down into these sections, and we're trying to find out basically what the landscape is for radiation therapists currently with respect to psychosocial care and in particular patient anxiety. So we decided to pilot the survey, which turned out to be a very, very valuable experience. And the way in which we got radiation oncology departments to pilot this was just to volunteer. And then we had 4 departments volunteer, which represented a mix of public and private institutions, and also inner city and outer metro departments. And within each of those departments, a key person selected 4 radiation therapists with varying demographics to participate in this. So they needed to complete the online survey, and then they needed to complete 12 feedback questions for us as well. We also sought the opinions of the key professional bodies that are supporting this research to provide informal feedback on our survey. So that is the Australian, New Zealand and the Canadian radiation therapy professional bodies. The results of the pilot itself were that we had 13 people complete and return our feedback and our survey. And the demographics of our responders were very much representative of our RT workforce, which is highly dominated by females of the younger variety who are working full-time and in clinical roles. We didn't collect information on the non-responders, and we don't intend to do so in our actual survey either. What we did with the feedback that we received was we put it into 4 different categories. The first was length. The pilot survey at the time was 30 minutes long, and we knew that was a risk. We knew that that would be a barrier potentially for people to complete the survey. So we took that feedback, which was provided by half of our responders, to say that was too long and it needed to be shortened, and we did shorten that survey. With respect to content, we have embedded 4 different existing tools within our survey, and the content feedback was often related to those existing tools, and we decided not to change anything regarding those existing tools so that we would be able to relate our results to the existing research that's already out there. We had one person comment that date of birth was potentially a barrier for people. We considered this and considered how we want to use our data and how we want to report it, and we determined that it would work better and we would be able to do more accurate reporting in the future if we had the date of birth necessary or continued to be there. However, we made it non-mandatory. And then with respect to functionality, that was really vital because people pointed out we had no back button on the survey, and when they pressed the back button on the browser, they lost their responses. The other feedback that we got was that it was an important topic and people were really happy to contribute, and I think that was reflected in our 81% response rate. The survey has gone live. We sent it out at the beginning of August, and in the last 6 weeks, we've had over 420 responders in Australia, New Zealand, and Canada, all from radiation therapists, which is our target demographic. We do believe that the pilot helped us to develop a survey tool that was usable and to improve the survey, and then also to maximise our responder rate and decrease the burden for our responders. So in doing this, we do hope to be able to ensure that more people can spend more quality time with their families, and that is with respect to families who are impacted by cancer, but also for healthcare professionals who are dealing with cancer on a daily basis. Thank you.